presentation by Dr. Yisak. His presentation focuses on young people with disabilities.
So part of this research, disability has come as emerging issue, which has never been in the first round of qualitative and survey. So we'll be looking at the type of disabilities, cause, consequence, and some conclusion and policy implications. Fortunately or unfortunately, we found only 14 young people who have been affected by disability among 181 in 4 sites to Tigray because of the conflict, Oromia and Sidama. More young men than women because of the conflict, and of course the same courts. This table shows a summary of the young people who have been really studied in depth their disabilities. This shows the right one is pseudonym because we use that, gender, court, disability types, cause, and treatment. So one thing that you can see is that mobility impairment, about 7, hearing difficulties 4, vision loss 2, and long-term epilepsy is 1. So you can see from the causes more from work-related or early childhood illnesses, and of course conflict affected because of participation in the combat in the north. In the treatments, you see the formal and informal, and sometimes mixed of them. More disability young people go to, mainly first they go to the traditional, then they go, if they are not healing, to formal because of limited resources. So to show you, we have the report already there, but just to show you some of the causes. Mobility impairment, accident, work-related battlefield. For instance, this one, a young one from Tigray has been involved in conflict, so has been injured by the sharpener in the legs and has been sustained for some time. Polio, we have minor report on that one. This one is a polio that's missed vaccination at childhood, affecting young person in our sites. Vision impairment, mostly in irrigation areas in Oromia have been affected a lot, and also in Hawassa where there is really sign C. Hearing difficulties, you can see that most of the young people are saying that they are hearing difficulties because of some accidents or untreated problems. So, but some of them have been fortunate, for instance, like Zoma from Sidama, who has been able, their family were able to send her to health care and she was healing, but others were not able to have that opportunity. Epilepsy has been one case. This one is one girl that has been really throughout our study for the last 19 years who've been sustained epilepsy, but that has also forced her to physical injury because of falling or lack of medicine or a lot of things, you see. So what are the consequences of disabilities? Economic challenge. Many families are unable to afford, or young people to get health care or buy medicine. Some of the parents have sold their cattle or what they have. Impact on education. For instance, one of our study children who is in university has been affected by hearing problems and has been affecting really his school performance. The other is on impact on work and employment. More young people who are disabled or are not working to do especially agriculture, and those who have been affected by the war were not able to do their work properly. So it affected a lot. The serious matter comes from social exclusion, mental illness. They have been excluded, insulted, a lot of stigma. As you can see, Duda or a deaf, some of losing teeth, Sharifo, a lot of stigma has been there. So to conclude, what are the disabilities? They vary by location and, of course, gender. In Oromia and Sidama, young people experience vision hearing impairment linked to weather condition and work-related exposure because In Oromia sites, we have young people working in irrigation and plant flower, so there are a lot of problems there. And in Sidama, also around Hawassa, the sun and the weather has been really impacting. In Tigray, young people have been affected by war, and 3 of them have been really involved and have been sustained long-term disability. Use of health care services, young people access mix of formal and informal, traditional areas, community remedies, health care service. They start with for informal because of no resource, but later some of them who can afford go to the formal. Economic burden on families is really high cost of medication has been affecting really, and especially in the areas where there was conflict and the price of health care has been very expensive. Something which has come throughout in our study is the mental health consequences. Disability combined with financial strain, social exclusion, mental health problems. So really the social stigma and the social exclusion for people with disability has been very serious. For instance, if I take one example, a person who was disabled, who could not do the farming, then has to go to serve a church because it can be afforded. But in the church, he was also excluded, marginalized because of disability. So there is a very limited space for people with disability to sustain life. So what would be earlier policy implications that we would discuss or pose? I think strengthening health care access is very important. Early detection is very important. The polio or hearing problems, if they get been treated earlier, or physical disability, then they could have been a better position. So early detection is very important at community level prevention. Inclusive health services, broader access to community-based health insurance, which is coming up now in the communities, but most of the households were not able to afford the small premium. So something has to be done. People with disability either to be included. I know there are the Ministry of Health working on that, but something has to be done targeting people with disability. Inclusive education, disability-friendly teaching methods, braille or written material for hearing impaired. As you see, one of the university has been really in a difficult situation because he cannot hear properly and his performance has been affected. So what is there in support for him? Raising awareness, reduce stigma in the school and at community, and that's very common. Employment and livelihoods, provide vocational training that really matches with their disabilities is very important. Social inclusion and awareness, promote community campaigns, challenge stigma and foster. I know there are less disabilities communities who do, association who do doing this one, but it's very important to strengthen that. Mental health and psychological support, integrate mental health into primary health care access is very important, and also offer trauma and counseling, psychological support for war affected people, young people who have been affected by the war. Still, they are feeling the trauma. It's not so their disability is really reminding of them throughout their life. So there should be something post-war. Trauma counseling and psychological support. Thank you very much.